Hi, this is Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County. Today is July the 28th, and we're going ahead with our usual update. I try and model the newest kinds of gear. This is my face shield. I really like this. It doesn't obstruct vision. It's not hot. And now that there are rules to wear face coverings at the gym when I exercise, I really find it hard to use a mask, and this works great. I'm socially distanced, so I'm going to take this off and show it to you. It's kind of nice. I got that at Oregon Tool and Supply. $20, it'll last you a whole year. So again, Dr. Bob Dannenhoffer, the Public Health Officer from Douglas County, and we'll start. Again, this is a time for you to ask questions and for me to try to answer them. So if you will put them in the chat section, we'll go ahead or the comment section, we'll go ahead and do that. As typical, we'll start off at the beginning with just where we are with this pandemic. So in the world, there's still a very active pandemic. We're at 16.8 million cases in the world and 662,000 deaths. It is really, really active throughout the world in the countries where it's active. Now, it's not active in all the countries. South America, the US, Mexico, India, Brazil, and Russia really seem to have the bulk of the cases. Europe is pretty quiet. Australia's had a little bit of an uptick in cases, but just a few hundred, and still very active in South Africa. So in the world, this is still very active. We clearly don't have this under control. The death rate now has been, or the death count has been going up for the last 2 months. In the U.S., we're at 4.5 million cases, and we'll hit 150,000 cases today likely. Just today, there were 64,000 new cases and 1,200 deaths. I mean, 1,200 deaths is a lot of deaths. I mean, that's as many deaths as we would have in a really terrible month of other infectious diseases. So 1,200 cases in one day is just stunning. California, Florida, New York, Texas, Georgia, and Tennessee, all with big case rates, well over 1,000 cases in a day. Although there are some states that are doing well. I think some of the New England states, Connecticut and Maine, have very low new case rates. You know, new case rates in Maine typically just in the single digits or the other digits here. In Douglas County, in Oregon, we're adding 200 or 300 new cases a day. We did add 14 deaths today, which is far and away our highest death rate. And again, that's not shocking because the deaths tend to follow cases by 2 or 3 weeks. So this is not a disease where you tend to die right off. We have some deaths right off, but most of the deaths after 2 or 3 harrowing weeks in the ICU. In Douglas County today, no new cases. Yay! First time in a whole month that we've had no new cases in a day, and we've only had 3 new cases in the last 3 days, suggesting we may be beginning to get this under control in Douglas County. So overall, we're doing great in Douglas County. I think when I've looked for mask use in Douglas County, it's very much improved. People have still been incredibly kind with our contact tracers, answering their questions, helping us to help control the disease. So I think we're doing pretty well here. Okay, so how is COVID compared to the flu? Well, COVID and the flu are similar in some ways. They're both viruses. They're both RNA viruses. They're both respiratory viruses. They're both mostly transmitted by respiratory droplets. COVID is part of a family of coronaviruses which have been around for a long time. Flu is part of a group of influenza viruses that have been around for a long time. Most of the respiratory viruses do start in Asia. So most flu viruses start somewhere in Asia or Australia. COVID also, we think, started in Asia. They're also alike in that they get transmitted from person to person. But there, they stop. COVID and influenza are in different families. COVID is less serious for young people. So whereas influenza is bad for young people and pregnant women, COVID does not seem to be particularly bad for children and pregnant women. COVID is really bad for seniors, much worse for seniors than is flu. Flu has a readily available quick test. COVID does not. Flu has a vaccine. COVID does not yet. Flu has a fairly effective antiviral treatment. COVID does not yet. The death rate from COVID is 20 times that of flu. So counting it in exactly the same way, the death rate from COVID is 20 times that of flu. So it's much, much, much more dangerous. In addition, many people already have some antibodies to flu because they had flu 5 years ago or 10 years ago, and they may have some antibodies. We don't think people have any antibodies to COVID. And so that's how they both compare and contrast. So they compare that they're both viruses, they're both RNA viruses, both spread by respiratory, but they contrast in that COVID is so much worse for seniors. COVID is overall much more deadly and has a much higher infection fatality rate. Oh, okay, so this other question we get, why did you stop reporting recovered cases? The reason we stopped reporting recovered cases at the beginning of the month is because it became clear that the end of isolation and recovery for COVID was not the same. So early on, and in most diseases, the leaving isolation is when you're recovered from the disease. So for the most part, like with measles, when you're no longer in isolation, 10 days or so after you have the illness, you're no longer sick. Similarly with chickenpox and similarly with many other infectious diseases. So when COVID came out, they put the end of isolation and recovery at the same time. It became very clear that COVID is not your typical disease. There are a lot of asymptomatic cases, and thus to consider that you've recovered when you never had symptoms at all didn't make sense. And then we know is that there's some people get COVID who are sick for a very, very, very long time. Sorry about that, who are sick for a very, very, very long time. Just tell them to send a message. And so it didn't make sense to have the end of isolation and recovery happen at the same time. And so what they did is they put recovery at 60 days after the illness and the end of isolation defined in a different way. Because of that, the cases we had counted as recovered would now have gone down. And I still look at the recovery by the old definition and the new definition. By the old definition, our recovered cases are 80. By the new definition, it's only 25. That would be so very difficult to explain. So we don't include that anymore. What we include is the cases in isolation. So the cases in isolation are the active cases. That's how we do it. Another question is, with the new metrics, can K3 go back to school in our county? And the answer is not at the current time. They weren't scheduled to go back. So the new metrics are a little confusing, and it talks about case positivity rate and the number of cases you've had per week over the last 3 weeks. And so to start kindergarten, it's a case positivity rate of less than 5. Ours had always been less than 5 until last week, and I think this week it will be less than 5. So it has to be less than 5%, and you have to have less than 30 cases per 100,000 for K3 to start. We almost certainly will be under 30. To get the other grades to start, you need to be under 10, and we were there until the 3rd of July, but over the last 3 weeks we've been above that. So if we want our kids to go back to school, and I really want kids to go back to school, we really have to work on getting the rate down. My wife always thought that kids going back to school was the most wonderful time of the year, if you've seen that ad, because kids would go back to school and you could finally get something done. So we really want our kids to go back to school, but that's incumbent upon the rest of us then to bring the rate down. And when we see new cases, many of these new cases are really associated with behaviors that we could predict are dangerous. Travel outside of the out of the state and back, bar hopping, going to large parties for the 4th of July, going to large bonfire parties with other people who are sick. These are all things that we don't have to do. We really do have to send our kids back to school because kids really, truly need to learn. So what are my recommendations for face shields versus masks for elementary students? Whatever works. I was in clinic today and saw some of the cutest little kids in masks. It was really adorable. So, and they were doing a great job keeping on masks. And if they can use masks, they should use masks. Face shields, they probably don't need to go to the industrial size, but there are some face masks for students in school that they decorate up and make them look like Batman or football players or policemen or whatever, all of which are really adorable. whatever works. In terms of protection, they're not exactly the same, but they're pretty close. So do I have any suggestions for handling depression and phobias in this time? Well, I think mental health issues during this time are really an issue. I think if you're anxious about the world, seeing the economic turmoil, seeing the illness, seeing the reports, seeing some of the reactions to it really would make you nervous. And if you're scared of things, and scared, especially scared of germs, having this called the invisible enemy is certainly not helping. Our recommendation is that all the mental health people and behavioral health people are working, if not in person, then by telemedicine. And I would truly, truly, truly recommend that you see one of these mental health professionals. We know that there are other things you can do to help with depression and other mental health issues. One is to take good care of yourself by getting plenty of sleep. The second one is to avoid overuse of drugs or alcohol. And the other is exercise. And you really can still exercise during this time. So I really, truly are recommending people do that. Yeah. So Andrew says, will you please address the viral disinformation video about a woman claiming to be able to cure COVID that the Trump administration is promoting? So, we've seen a bunch of these, and I don't, as you know, I don't talk politics. We've seen a bunch of these viral disinformation things that say that certain things work when there's no other data that it works. I saw this woman today, gynecologist, saying that COVID is 100% treatable with hydroxychloroquine and azithromycin. Look, there have been a bunch of really good, really rigorous studies, and it really shows that COVID either doesn't help at all or only helps very little. So when anybody claims that they've got the 100% cure, you really don't think if there was really a 100% cure that people wouldn't do it. It's not a 100% cure. So, I think there's a lot of bad information going around. So let's not spread it. So COVID patients on a ventilator, what's the survival rate? That's a very interesting statistic. And it's a very interesting statistic because it's really high. Like in other diseases, if you go on a ventilator, you have a really good chance, 80 or 90% chance of coming off the ventilator and doing it. The best rates I've seen, the best survival rates are 60%. I've seen other places with survival rates of less than 20%. So there's something about COVID and ventilators that doesn't mix very well. Now, sometimes you have no other choice, so you do it. But ventilators are certainly not magic for people with COVID. So will I give a prescription for hydroxychloroquine? Well, for the right thing. So hydroxychloroquine has been shown to be safe and effective at lower doses for rheumatoid disease and whatever. And I have a couple of kids who are taking that. In terms of giving hydroxychloroquine for COVID, I would say no, because I don't see any benefit and there clearly is some risk. And Oregon actually has a rule that pharmacists are not allowed to fill a prescription for hydroxychloroquine for patients unless they're part of a study. So can I talk about the Rite Aid testing process and the results are going through OHA, Robin says. That's very interesting. So Rite Aid is doing these swabs, apparently self-administered swabs, which they're sending away to another place. They're supposed to send the results back to us. We haven't gotten any yet. So either that means they haven't done any here in Douglas County yet, or the results aren't back yet, or something's up with the reporting process. We haven't seen any yet. We think it's a PCR test that they send off, done by a reputable lab. So we think it's okay. And so if people want to get that test, that's perfectly fine. So how long are people typically infectious and needing to be quarantined once they get a positive test? This also changed in the last week. So the story is if you have a positive test, it's minimum of 10 days or longer if you continue to have symptoms. You need now to be 24 hours fever-free without the use of a fever-reducing medicine. Or if you're really sick, you're hospitalized, still febrile, or severely immunocompromised where your body may not fight it off, then it's 20 days. So it's 10, the shortest is 10 days. The longest could be as long as you still have fever. The longest we've seen on that is 20 days, so somewhere between 10 and 20 days. Yeah. So Stephanie says, why isn't a mouth swab good enough? Why do we have to do these nose swabs? And actually, there's a study going on right now at the U of O that'll tell us that. And initially we used the nose swabs. There are a couple of groups that have used saliva, and so U of O right now is doing a correlation study where they're doing simultaneous swabs of the nose, back of the nose, the front of the nose, and saliva, and they're looking to see how well those correlate. I am really looking for the results. Yeah. Yvette says, is there a way to improve test results getting back sooner? Took 10 days to get mine, and I'm so sorry about that. 10 days is way, 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 way too long. The latest it should be is the next morning. So I'm not expecting that people are necessarily going to be up all night doing these, but you should certainly get these back by the next morning. 10 days is way too long, right? Because your infectious period, you're probably most infectious in the first 5 or 6 days. So not to know about it for 10 days is problematic. We need to have just more testing. And I think we're probably wasting some testing now. So I will be a little political here. We really don't need to be testing every basketball player every day forever. While there's a shortage of tests, we really shouldn't be testing every football player ever, because we need those tests for sick people like you, or for people who are having pre-op testing. So we really, in our country, need to get our arms around testing. In addition, we need more testing. So you typically need 50 tests for every case. So think about that. 50 tests for every case, which means that your test positivity rate would be 2%, which is where we were forever and we would like to get back to. So to have a test positivity rate, you have to do 50 tests for every test. 60,000 cases in the US today. So if I'm doing my math right, that means we need to have 3 million tests a day available. We're not even close to that. And so we're not even close to that. 3 million tests a day, we're not even close to that. And it's because the tests just aren't available. So there are some new antigen tests, like they're doing at Nova. There's one by Becton Dickinson. And we looked today about, that one of the clinics in town is looking to get that. And they say, well, maybe in September we'll get back to you on when we can ship it. That doesn't work. We need to have lots of testing so that you don't have to wait 10 days. And the reason yours took 10 days is that higher priority tests got done first. So for people who were traveling, believe it or not, were higher priority than you. People who were pre-op were higher priority than you. Or people in the hospital or healthcare workers would be higher priority than you, presumably. And that's why you waited 10 days. That is totally unacceptable. We really have to get this down to a day or two. And we were there, in the first week of June through the first week of July. We were there. We would do these tests on Saturday in Reedsport. I had them all back by Monday morning. We do them on Tuesday. They'd all be back by Thursday. And that's what we need. We need to get back there. Can give the age ranges of people who have COVID in the country. We've had none less than 10. We've had a group in the 11 through 19 age group, and then our oldest has been in the 80s. So from the teens to the 80s, we didn't see very many cases in the teens and 20s until this last month. We've seen a lot more in the teens and 20s as kids have been more out. And I will tell you, they've been some of the most problematic, with lots of exposures, parties, sleepovers, whatever. Ooh, those are worrisome because we think that kids 10 and above spread this just as well as adults. Yes, can I talk to the vaccine that has made it to phase 3 trials? How long before it's available to the public? So the vaccine that's in phase 3 trials is the Moderna vaccine, which is an mRNA vaccine. It's got really good preliminary reviews. So phase 1, just a few people looking for antibodies and side effects. Phase 2, bigger group of people looking for antibodies and side effects. Phase 3, 30,000 people looking for antibodies, side effects, rare side effects, and looking to see how much protection it gives you. They started with that there. It's going to be available to the public when the phase 3 trials are done. I think for the public, this is going to be the beginning of next year. I don't think it's going to be available to the wide public. However, last time we were asked is, how can you sign up for trial? And we have the answer to that. And so maybe we can put those in the chat. So there are 2 ways to sign up for the trials. So if you want to sign up for the trials, I'd say go for it. So Brittany says, is it safe to hike at Susan Creek with the kids? Yes. So again, outdoor activity, many times safer than indoor activity. Outdoor activity, relatively safe because there's a lot of dispersal. I would bring my balaclava so that if I were walking and there were people who were meeting or something on the trail, put my mask up for a little bit and then take it down. But I would strongly encourage people to hike at Susan Creek. Now, I don't encourage you to go to Yosemite or the people from Yosemite to come here because, again, that's that interstate mixing, which is so problematic. I really encourage people to stay close to home and enjoy the natural beauty. So there's a study from Johns Hopkins that COVID targets older men more than older women. Is that true here? We've had so few serious cases that it's a little hard to know. Our most serious case is a younger man. Our next serious cases are 2 older women and then a younger man. So it's a little hard to know. We don't really have enough cases. When I look at the data in Oregon, it seems to be both older men and older women. Now remember, the underlying diseases really play into this, and men are much more likely to have cardiovascular disease, which is one of the risk factors. So that probably is correct. So where do we send our reporting ideas? Great. So we still have very few takers. Remember, we have 3 challenges out there. The first one is if you have a way to improve the reporting that comes out every day, you should send it to us at mail, M-A-I-L, at douglaspublichealthnetwork.org. A big long thing, douglaspublichealthnetwork.org. Second one we have is if you're the governor for a day, what would you do? We've got one great response there that the governor actually did. And then the third one is a $50 bonus for anyone who can substantiate the rumor that we've seen around the internet, around the country, that says, I know someone who knows someone who knows someone who went for a test. They never got the test done, but then they got a report that they were positive. How could this be? We think that's an internet hoax, and so I have $50 for anyone who can show me that ever really happened. I think that $50 is pretty darn safe. So how do we figure out the percentage of cases in Douglas County? Could that be added to your chart every day so we can follow how we're doing? I don't know exactly what that means. Perfect chance then for you to write that up in great detail in mail at douglaspublichealthnetwork.org, and I promise we'll look at it. So, and since testing results are a problem, what's the point in testing just to find the positivity rate? Well, we're not doing it just to find the positivity rate. What we're doing is we're doing it in the hope that we can get them back sooner and actually make a difference. The problem is that so many labs are pulling back on the number of tests for all kinds of reasons. So I was at a meeting today and they were saying that they're lacking in reagents which are the chemicals that go in the machines, and some they're lacking in these things called pipette tips, which is the weirdest little thing. So you've probably seen on TV this deal where somebody has this little tool that dips into a bunch of vials at once and then sucks juice out of a bunch of vials, and then they put it in a bunch of different vials. And to do that, there are these little plastic tips, which are really little plastic tips. I mean, they must cost like 1/100 of a penny to do it. But there's this worldwide shortage of pipette tips. They're apparently made mostly by one company in Switzerland that's overwhelmed. And so there's a shortage of pipette tips, which is making it hard for us to do that. There's also a shortage of swabs. Can you imagine really Q-tips and little plastic parts are the problem, but it does appear to be the problem. So we're not doing things just to find a positivity rate. We're doing the tests because we want to know the answers. So we're not doing it just for the positivity rate. So someone says, I have lupus and I'm hydroxychloroquine. I thought I heard you say I can't get my pills now. No, you can't get hydroxychloroquine for COVID, but if you were taking it for lupus, then you can get it. And especially if you were on it before there's a date. If you're on it before a date, then you can continue to get it. If you have troubles, your doctor needs to talk to the pharmacist and say, look, this isn't for COVID, this really is for lupus. So you can get your hydroxychloroquine, but we think hydroxychloroquine for COVID just doesn't work. And I don't blame anybody for trying it. The story is that early on, people make observational studies. So there have been observational studies about Pulmicort or budesonide. There's been observational studies about Pepsid. There's been observational studies about lots of things. And most don't pan out, but some do. Right, so I give this story, and people have heard. If you've heard it before, excuse me, but it's about smallpox. So Edward Jenner, a little doc in the UK, notes that smallpox, terrible disease, but notes that milkmaids don't usually get smallpox, especially if they've had cowpox. So cowpox, which is not a very serious disease in cows, and milkmaids would get it on their hands when they touched the infected udders. And he found that people who got the cowpox didn't get smallpox. So what he did is he took some of the vaccinia, which is the cowpox, and gave it to people. Other people, they got a sore where they got the vaccinia, and then they didn't get smallpox, and that's how he came up with smallpox vaccination. So observational studies are absolutely great. And then what you should do is an observational study, and then you should do a double-blinded, if possible, control study, and then you should look to see if it works. And so that initially people said, well, hydroxychloroquine may work, not totally unreasonable, but then we've done the double-blind control studies, and it doesn't work, so we should just stop. So from what I know, do you think COVID was here before November, December? I do not think so. So there is a group that looked at viral RNA from people to find out just what things were circulating. There is no data suggesting that it was here in the U.S. before mid-January. So not any data that it was here before mid-January. So I don't think it was here before November 7th. Now, there are a lot of people who were quite sick. So I have a friend who was really very sick, very weak, had this terrible lung disease and whatever, and was sick in November, December. And, certainly could have been COVID if COVID was around, but they've checked and they haven't found it. So we've really not found this. Maybe it'll come out later, but I don't think so. So children and eventual COVID vaccine, what's your take as a pediatrician? Well, in general, I think, vaccines are a pretty good thing. We don't know yet if vaccine is also going to be for kids or just for adults. They've not tested it on any kids yet, so I don't know. But generally, vaccines are safe and effective, and if this one is safe and effective, I'd recommend it. Julia says, do masks really work? Yes. So I think this is a second question from Julia. You seem to have a lot of questions here that are sort of interesting. So masks really work. There are numerous studies to show. Now people say, well, there's been no double-blind control studies on masks. Well, if you know what a double-blind control study is, it means that the person who's getting the treatment can't tell if they've gotten the treatment. I don't think there's any way to take a mask and not have the person know. So you could never do a double-blind study of masks. You could do good observational studies, and they have done good observational studies, and masks really seem to work. Now, do masks alone work? No. You also need to socially distance. You also need to stay home when you're sick. But masks really do seem to work, and there is accumulating data that masks really do work. So Chris says, from what I understand, transmission is mostly via droplets that are airborne. If so, do we need to continue the hypervigilant sanitizing of surfaces? Well, people have gone a little bit overboard on the sanitizing of surfaces. So I was at Lowe's the other day, and this guy probably spent 5 minutes washing the shield there. Probably not a high risk. I mean, it would only really be a risk if I was going to lick the shield, which I was not going to do. But sometimes people feel better when they're very vigilant about washing. Again, we don't think this comes mostly from surfaces or from Amazon boxes or things like that. So, I do want people to wash their hands, but if you're not hyper-vigilant about Lysoling everything, I think that's fine. I've said, we see these pictures of people walking down the street, spraying bleach down Chinese streets. That cured exactly 0 diseases of COVID. But if it made people feel better, that would be good. So are the N95 or KN95 with valves okay to use, or do they do more harm than good? So There are masks with exhalation valves, and exhalation valves are good because it tends to decrease the warmth and that feeling of claustrophobia around your face. And so if you are using masks to prevent yourself from inhaling things, because they shut during inhalation and open during exhalation. So if you're in a place where there's fumes, or if you're in a place where there is tuberculosis or something, those are fine to use because you worry about inhalation and not exhalation. In this disease, you're using the masks not only to protect yourself, but to protect others. And with an exhalation valve, there's the risk that if you had the disease, didn't know it, we're in the pre-symptomatic stage, could spew things out through the valve and get others. So we would for this disease, we would recommend not using a mask with valves. So Tanya says, I can't see how the Rite Aid self-administered test can get up there far enough. What are your thoughts on this? Well, their test is licensed for interior nares swabs. So you only have to go in 2 centimeters, which is a little less than an inch, and most people can do that. The nasopharyngeal swabs, which are the highest standard, have to go in 5 inches. I saw a video the other day of somebody trying to do it to themselves and they couldn't. So yeah, if you had to do the deep nasopharyngeal swabs, that wouldn't work. But these anterior nares swabs are actually now getting pretty good. They're almost as good as the nasopharyngeal swabs. When we have some of those anterior nares swabs that they do at the state lab, and they have been remarkably good. We really, really would like to get away from those deep nasopharyngeal swabs. They are no fun. They're no fun to do. They expose the person who's doing it. They're no fun to have done. And so we would love to get to something. We'd love to get to a spit test. So as for people who've been listening for a while knows that's what I want for Christmas, is a quick, easy spit test where you could do the spit thing, check it 15 minutes later, I'm good to go. Or if it's positive, I'm not good to go. We think if you could do universal testing like that, within a few weeks, you could really drive this down to zero. So Travis says, I'm on multiple immune suppressing drugs and I'm not supposed to get live vaccines. Are the vaccines being made now live vaccines? No, there are no live vaccines. Now, depending upon what the immune suppressing drugs you are on, there may or may not be restrictions on getting vaccines, but there in the U.S. there are no live vaccines. They apparently are working on one in China, but I don't think it's going to work. So Ashley says, is all the sanitizing getting rid of good bacteria and weakening our immune systems? So our immune systems depend upon us being in contact with many germs. And the very best way to get in contact with the many germs that will help you is to work in your garden. And so work in your garden, eat some tomatoes off the bush, dig around in the garden. That's the best way to do this. Respiratory viruses don't really do much to strengthen your immune system. But the good bacteria, best way to get it, work in the soil. So Joanne says, what do I think about 3 or 4 layer masks? Well, a recent study came out that suggested that 1 layer masks didn't stop much of the spread. It got much better at 2, even better at 3, and best at 4. The advantage of a 4-layer mask, it protects the most. The disadvantage of a 4-layer mask, and I think this one is a 4-layer, is that it's hot. Not much gets through, and so it does get hot and sweaty. So the more layers you get, the more protection you have, but the less comfortable it is to wear. And I would much rather have somebody wear a 1-layer mask than not a 4-layer mask. So again, do the most you can do, but no need to be so terribly uncomfortable. Okay, well, I have a few things here. People wanted to know about the shield and glasses thing that I was wearing last time. You can get it online. It's the Adafruit, Adafruit, is one of the companies that makes it. But if you look at theirs, you'll see several others. They vary in price anywhere from like $1 to $20, I think, depending upon the quality of the materials. Okay, so Christian says, can I address and explain the new metrics on school reopenings in Douglas County? The answer is yes. I spent most of my weekend doing that. And so let me explain a little bit more about sort of all the different roles. And it is a little confusing because I have a bunch of different roles. So at the current time, I'm the county public health officer, and that is the physician who's responsible for county health policy. I'm also the public health administrator who signs public health administrator things like quarantine orders and stuff like that. I'm also working at DPHN to help them with strategy, and I help them with things there. And then I also work at Umpqua Community Health Center, now known as Viva, as a pediatrician. And then there's a bunch of other things that I do. And so it sometimes gets confusing, and early on, Tim Freeman got me a bunch of hats so that I could be very sure that I was wearing the one hat at one time or another. So I do wear the hat as the public health officer for Douglas County when I'm doing this, but then I get asked to be on state commissions and whatever, and when I'm on there, they identify me as the public health officer in Douglas County, but I'm not speaking for the county when I give the governor advice or when I give the head of ODE advice about where we should go. So again, the county does not really have a dog in the fight when it comes to opening schools and not opening schools. And so when I'm on the Healthy Schools Reopening Council, which I am, or the governor's medical advisory panel, which I am, I'm just giving advice. I'm not speaking for Douglas County. I'm just giving the advice of somebody who's been doing this for 40 years. And really, I have no specific dog in the fight. So we spent a lot of this weekend working with ODE and whatever, coming up with the new metrics. And the new metrics first looked at the data. They said there are other places in the world that have reopened schools. Who has reopened schools? When have they reopened schools? And what have they found? So we looked all around the world, in Denmark and Germany and other kinds of things. Other countries have opened up schools, and when they opened up schools, they did certain things. One is they all had low rate of disease when they opened schools. We could not find any place that successfully opened schools when there was a high rate of disease. And we found out what those rates were. And those rates can be expressed in different ways, but if you express them as number of cases per 100,000 per week, taking into account that if you use, by day, you could have a day with 4 cases and then the day with no cases, so the average over a week. And so with 10 cases per 100,000 per week, well, Douglas County has 109,000 people, so it makes the math easy. And so we'd have to be less than 10 cases per week to open up all of the schools and a positivity rate of less than 5%. We had a less than 5% positivity rate until this last week, and we were less than 10 cases per 100,000 until the beginning of July. So we were there. I mean, we were there from the middle of April all through May, all through June, and the first part of July. So we were definitely there before, and we could clearly get them again. So these metrics rely on having a low positivity rate and less than 10 cases per 100,000 per week. Once you're open, if you're up to 20, that's okay, but over 30, they would say, look, you really need to close again. So that's the range. So 10 to open, 20 to be caution, and 30 to close. Now for kindergarten, a couple of issues. Kindergarten is much more important to do in person because kindergartners obviously may not be able to do distance learning. They obviously can't type their questions into the chat thing. And the first 3 years are mostly about learning to read. And I think the data is very clear that it's best to learn and read by somebody to teach you rather than by doing that online. After the 3rd grade, you can learn by reading, but really the first 3 years is learning to read. And that's why the metrics for kindergarten through 3rd grade is up to 30 cases. So right now, we couldn't open up to either kindergarten or other grades. We think, however, within a few weeks, if we continue to see these good trends, that we could open up certainly for K3, and that hopefully by September, we could be available to open up for everybody. But it's going to take work. It's going to take the same kind of work that everybody did in March and April, and that is to really limit gatherings, to really be careful about travel, to be really cautious about not going to work when you're sick. We continue to see, when we look at our new cases, people who've had foolish travel. So I was looking at a case yesterday from a different county, but this person had visited all the casinos around the West, many in high-risk areas, not wearing a mask, and so this person was now positive, and what a shock that he'd been in a bunch of casinos exposing other people. That's the kind of stuff we don't have to do. We have to send our kids back to school, so please, please, please do all those things. So can you also do ads and messages about being kind and empathetic? Yeah. I think people in Douglas County have been have been quite kind and empathetic. There is a little bit of heated stuff out there. I think the people who are really making a big deal of this get more than their share of attention. I saw a video about this woman at Papa Murphy's. It was like, really, lady? Just pick up your pizza. Just put on your mask, pick up your pizza, and go. But I know people are doing it. So I really thank everybody who is being. I really thank everybody who's following the suggestions, and I really do feel for people at stores who have to uncomfortably say, "Ooh, could you wear a mask?" So yeah, we'll think about doing a graphic here about being nice to that. So Heather says, do you think we will shut down again? I don't think so. Although, there are some people out there who are really much smarter than I. There's this Michael Osterholm from University of Michigan, who he's had a career in following pandemics. And if you want to know stuff about pandemics, he's the guy. And so, he has this, he talks weekly or so about what's going on. And he spoke this morning, and he was quite dejected. He said in much of the country, we have lost control of this, and we are beyond doing testing and contact tracing. Because testing and contact tracing only works if you have a relatively low number of cases. So if we had 1,000 cases a day in Douglas County, there'd be no way to do 50,000 tests a day in Douglas County. There would be no way to do the contact tracing, and it would be out of control, and we would just need to let it sort of burn itself out or lock down or whatever. He felt that there are a number of places in the country where we're past testing and contact tracing, and recommended that there be places in the country that do shut down. California's already done lockdown again, and I really, really, really hope we don't do that. I will tell you, in Oregon, we don't need to do that yet. Douglas County, we clearly don't need to do that yet, but we can't be cavalier, because if people continue to travel and go to parties and whatever else, and we do get up to 20 or 30 cases a day, it'll be beyond our ability to go ahead and keep that under control, and then a lockdown may be necessary. So please, let's not do that. A lockdown would be really devastating. Heard from somebody who was running a restaurant, and they said, well, here's the trouble. We locked down in the spring, and we had all these perishables that we lost or had to give away or couldn't use. And then we bought them back, and we started, if we had a lockdown again and I had to lose my perishables again, that would really be demoralizing. And some of the strategies that people used during the first lockdown, which like the PPP loans, they're not going to be there. So we really, really should avoid lockdown. And to do that, we just have to be a little smarter. And we don't have to be like super smart. This doesn't mean like stay at home all the time, cover your face with duct tape so you can't breathe. It doesn't mean to do those things. But it means like don't go casino hopping. It means things like don't go to a party while you're sick. So somebody says, this is a good question, so why do I have to stay in quarantine for 14 days if I'm a contact and don't have symptoms and need to work? That is that's the big question. Well, the reason is if you're a contact, there's a chance, maybe 30%, that you'll get the disease. And if you get the disease, the first day or two when you have the disease, you will have no symptoms. And if you're at work and exposing others at work, you'll now expose others, and then those people will get sick, and then their contacts need to stay in quarantine, and it just goes. We in our country have not done a good job, though, in supporting people in quarantine. Early on, I suggested that if you're in quarantine, you should immediately continue to get paid for staying in quarantine as an incentive not to work. This is a really hard one because I know people need to work. We have a country where there are a lot of people who truly live paycheck to paycheck, and going 2 weeks without a paycheck is really, really, really hard. So public health can help by buying food and sundries and whatever, but for a lot of people who have bills, that won't cut it. But the reason to stay in quarantine is so you won't do it. Now, we can't make you stay in quarantine, but oh my goodness, imagine now if you expose 5 or 8 workers, and then those 5 or 8 workers get sick, are out of work, and they have contacts and they're out of work. It just goes down the line. So we ask people to please stay in quarantine, but I know how hard it is. So do the positive Norris Foreign numbers affect our schools? And how many of our cases are from that outbreak? I think it's in the low 20s. So yes, it clearly affects our number of cases, and it clearly affects our case positivity rate. So absent the Norris Farms, we would meet the positivity rate for schools. We would still not meet the case rate for schools, I don't think. But the story is it clearly affects us. And so I think the Norris Farms thing, well, bad as it was, is now kind of under control. And so I would think over the next few weeks, we're not going to see more cases there. But we still more than half of our cases are not from Norris Farms, right? So more than half of our cases are from travel or from people going to parties. Please, please, please work on that. So do we have any data from contact tracing tied to the protests? Yes. So we ask people when we do the interviews about being in the protests and whether they've been in any large gatherings. We haven't seen any, but, this is Douglas County. We've had, the Black Lives Matter protests here have been 30 or 40 people in front of Fred Meyer's outside, nicely spaced, wearing masks. There's a lot of questions about, are gatherings related? And so the gatherings could be anything from the Trump rally in Arizona, the Trump rally in Oklahoma, the Black Lives Matter things that are happening in Portland and whatever else. Really hard to know. There's some data that cases increased after the Trump rally in Tulsa. There's no data that they increased after his meeting in Arizona. There is perhaps some data in Minnesota that there were some few cases that went to the rallies, but it was hard to know if the cases were there. Eugene, there's not been any specific data. Actually, most of their cases have been tied to stuff that people do at the college. And in Portland, I've been trying to get that information from my friends in Portland. They say they haven't seen it, but I haven't actually seen the specific data. So when is Aviva getting the new doctors you mentioned early this month? They are there. So they started July the 1st. And I work with one of the doctors today, Dr. Kumar. She was just delightful and wonderful. And I work with a couple of the other doctors. I actually had my appointment with my new doctor at Aviva a couple of weeks ago. He was fabulous. And so if you don't have a regular doctor, I would give Aviva a call and I would see if you can get an appointment. I mean, these are people who are recently trained. These are people who are incredibly kind. And these are people who are so dang smart. So you go ahead and do it now. So call Aviva. Say you want to see one of the new resident physicians. So Chris says, is the local medical community prepared for the upcoming flu season with COVID still active in Oregon? Well, we worry about the flu season. And we worry about not just about flu, but all the other respiratory viruses. Right? So lots of kids go to school and they get colds with all kinds of other respiratory viruses. And at least early on, it's very, very, very difficult to separate out COVID from the other respiratory viruses, especially in kids who don't tend to get very sick with this. And so that's the big concern. It's flu plus all the other respiratory viruses. Now, if people are careful about using masks and people are careful about social distancing, we hope that the flu season is going to be a lot less, and we hope that the respiratory virus season is a lot less, and we'll see. We'll see what that shows. We do recommend that everybody get a flu shot this year. We think there are going to be ample flu vaccine this year, and we will be doing some drive-through flu clinics because we do think everybody should get the flu vaccine. Okay, Well, we're coming to the end. Remember, we have 3 challenges here. The first is, if you can think of a way to better report the data, please send it to us at mail@douglaspublichealthnetwork.org. The second is, if you were the governor for a day, what would you do? So if I was a governor, I might think about a travel ban. And so you might put something in there like that. Or if you were the governor, you would have high school students, as one of their projects, stand outside of grocery stores to see about mask use. If you were the governor, maybe you would do nothing. So this is your chance to be governor for a day. And the third one is that $50 is still out there for anybody who can provide evidence that would back up the story that a friend of a friend or a friend of a friend of a friend went for a COVID test, never had the test, but yet got a positive result. I haven't seen that. The only thing that I've seen closest to that, which is substantiated, is a note went out to military recipients that said, if you've had COVID, you could donate convalescent serum. And it was a little less clear to suggest that I haven't. I mean, could have been written much clearer. You'd think somebody would look at these things when you send them out to 600,000 people. So, I have the deal that if I send anything to more than one person, I have somebody proofread it before I send it out. So you think if you were sending out to 650,000 veterans, you would probably have more than one person read it. And it was a little unclear. It sort of suggested, you've had COVID, you could donate convalescent serum. Ooh, badly written. But if anybody can find evidence of this thing, that somebody went for a test, never had the test, and yet got a positive result, let me know, because there's $50 on the line. Okay, we'll do this again on Friday. Again, I'm Dr. Bob Dannenhoffer, the Public Health Officer, and many other things for Douglas County. We'll see you again on Friday. Thanks.